when you look at telehealth services, right? And so obviously that became a big thing during the pandemic. But as a direct primary care, they can call you, text you. Kind of talk a little bit about like how are you using telehealth to build a better connection to your patients?
It's really that availability and flexibility and convenience that telehealth provides, especially since the COVID era, patients want to stay home. Having the flexibility to say,
Hello, everyone. This is Theo Harvey, and welcome once again to Medical Success Secrets. I'm here with Dr. Ansari. Dr. Ansari, how are you today?
Good. Thank you, Theo. How are you?
I'm doing wonderful. I'm doing wonderful. Everyone, thank you again for joining. Today, Dr. Ansari is going to talk to us a little bit about something very interesting. If you're a practicing physician, it's important to know different business models. And she's a founding member of Harbor Direct Primary Care based out of Southern California. And she has an emphasis focused on holistic care for internal medicine, women's health, lifestyle medicine, and she really is focused on helping people look at different opportunities that you can build your practice around. So, Dr. Ansari, let's get into this.
Okay.
Um,
Let's do it.
one of the things I want to talk a little bit about is like, direct primary care models, right? We're seeing, higher satisfaction studies, better health outcomes. Can you talk a little bit about like, how have you seen this play out with your patients?
Sure. Yeah. And I think that's exactly right. The studies are there. I think patients in the direct primary care model, they seem happier and overall seem to have better health outcomes. So, I opened about 14 months ago, so I'm still relatively new, but I will say that I think in general it's really just improved access for patients because I use a membership-based model, meaning that I just work for my patients, I work with my patients, and I'm not working for an insurance company or a corporation. I'm really able to just provide more of like a personalized experience for my patients. And they also just get direct access to me. So that can mean the insured patient who is just frustrated with their insurance, having to wait weeks or months to see a doctor, or even in uninsured patients who otherwise would not be getting the care that they need and deserve, have a new primary care doctor that's almost like a concierge doctor, but at an affordable price.
Yeah, that's a good point. I mean, can you talk a little bit about the differences? Obviously, I've heard of concierge medicine,
Mhm.
direct primary care. Is there like a distinguishing, characteristic of those two type of
Yeah,
practices?
I'd love to. So, direct primary care, like I said, uses a monthly membership model. So, similar to a gym membership, and you pay as you go. There's no long term commitment. A concierge doctor will be probably just as accessible as a direct primary care doctor, but they usually bill the insurance in addition to the patient. So you're paying this premium, which is usually about 3 to 4 times higher than a direct primary care membership. And then on top of that, you're still paying a copay, and then you may still have the surprise insurance bills.
Yeah, we've
Mhm.
seen that as well. My journey toward and thinking about concierge medicine and direct primary care, we were already told that, look, it's great because obviously you have access to your doctor and opportunities to kind of explore how they can help you. But to your point, sometimes you have medical bills that extend beyond the practice scope of your primary care doctor, direct primary care, or concierge. So having some kind of insurance, like you said, for some of those surprise medical bills can help. And so is that what you're seeing, the model where a lot of your patients kind of have some insurance to cover some of those bigger, maybe accident insurance, things like that. But then the day to day stuff, which, to be honest with you, preventable medicine is really where healthcare is going and needs to go. Do you feel like
Exactly.
they need to have both, right? Is that correct?
Yes. So I think, kind of in the ideal situation, a patient can really save on their out of pocket medical expenses with a direct primary care membership and then pairing it with more of like a high deductible or catastrophic plan, similar to kind of what car insurance is these days. It's great for the big things, for the catastrophic things, but for the preventative things, we usually pay out of pocket, right? So I think that
Yes.
that can be used in the same way with a direct primary care membership and a higher deductible insurance plan.
Yeah, I agree. And
Mhm,
and with the advent of high deductible insurance plans, right? People have
mhm.
house spending accounts,
Yep.
flexible spending accounts, and so it's kind of like all these different things to kind of delay the cost, but you're still paying
Right.
into something. And so
Right.
why not use that toward some services that you could use, which is access to a primary care physician when you need it. And
Exactly.
so it definitely makes sense. Let's talk a little bit about like how did you come to this model, right? And going
Sure.
down this pathway. We
Yeah.
talked to a lot of physicians. A lot of our physicians, build Medicare, Medicare Advantage, build
Mhm.
commercial insurers, right? Specialties like cardiology, nephrology, to primary care. What's the challenge that you saw, and then how'd you overcome that to get to this point to kind of really delivering direct primary care?
Unfortunately, I think physician burnout, it's growing. Even medical students are burnt out. And I think that that's just a direct reflection of that fee for service model where I worked for about 6 years prior to starting the DPC, starting Harbor. And in that model, you're paid for doing more in less time. And then burnout just really adds up. And so I knew I wanted to continue to provide patient care, but I wasn't able to do it the way I wanted to, in a 7-minute visit. So I just started to look into different ways of delivering care. And I think more doctors are doing direct primary care and there's more resources for us now. And I was just able to find, honestly, a Facebook community of direct primary care doctors. And I sort of lurked on there for a little while until finally coming to the conclusion that I wanted to try it myself.
And then how did you kind of make that transition? Was it like a cold turkey or is it transact, slowly building it over time as you kind of learn the model? Can you kind of walk us through that?
It was cold turkey. I basically just kind of started it from scratch after doing a good amount of research for about 6 months. My family and I moved to Orange County. And so we were brand new to the area. I mean, I was born here, but I haven't lived here in several years. So I was brand new here. So I just kind of started full force with Facebook, Instagram, social media marketing, trying to just get myself into the local community however I could, meeting chiropractors, physical therapists, local business owners, and trying to get my name out there that way. And little by little, it grew, started with one patient and then it grew.
I love it. I love it. Just having that business hat on, that business savvy. Marketing is key, right? To your point, that's kind of how we discovered each other as well, right? Through social
Yes.
media and putting
Hmm.
your awareness out there. So when you kind of look at your specialty as kind of women's health and kind of helping that, 2020 study revealed that 70% of women report experiencing gaps in healthcare coverage,
Yep.
particularly in areas of reproductive and preventative care. How is your practice addressing these disparities in this, kind of
Sure.
interesting environment we live in now?
Yes. So I think it's kind of multifactorial. So I think the busy mom, for instance, is going to put her health last. Okay. She's going to, take care of her family first and just may not find time for herself. And that the data shows that. So I
Mhm.
think having the direct primary care model where women really feel comfortable just texting me, they don't always have to come into the office. We can do a lot of things virtually. That helps with the gap. They're able to still get the care they need while still taking care of their kids at home. And then also there's, another aspect of it, which yes, it's women just not really feeling heard, I think, not having the access to the care that they need. So I try to just provide a safe space where there's no judgment. You don't have to have a certain insurance. You don't have to go. Of course, I follow guidelines and evidence-based medicine, but I think with direct primary care model, I'm not dinged for certain things I may or may not do. So
Mhm.
I'm able to take more time with my patients and kind of come up with like a more personalized plan that works for them and that they're comfortable with. And I think in that sense, it really helps kind of fill those gaps for women.
Mhm, mhm. Now, I love that. That's having the ability to practice medicine, right? To your point, a lot of doctors under this fee for service model, if they work for a large healthcare system, they're, looking at RVUs, basically the ability to how many patients they're seeing on a typical day.
Yeah.
Unheard of, not unheard of to see 20, 25 patients. I literally had a primary care doctor. I don't think he looked me in the eye once. He was on his computer putting
Right.
his note. I think to your point, people want a connection with their doctors, having a better, more informed connection, because a lot of stuff we talk about is our health, and that can be very personal. And
Mm.
sometimes you don't know what to ask, right? I mean, I'm in healthcare. My wife's a nurse. I literally had to bring my wife in to go talk to this doctor
Mhm.
because I was getting frustrated. I'm like, wait a minute, I'm in healthcare. I talk to doctors all the time, and I'm frustrated because I can't communicate what's the issues with me personally, right? So I had to bring a translator in to help me. And so I agreed, having that space and that time just to be quiet and giving the patient time to kind of reveal their issues, I think is so important. Um,
Definitely.
when you look at the space that we're in is remote care. And so basically we provide like devices, blood pressure monitoring, chronic care management services for patients at home. And that's enabling of that is telehealth services, right? And so obviously that became a big thing during the pandemic. And so
Mhm.
now we're, kind of going back to normal where people still kind of see the doctor. But as a direct primary care, you kind of hinted at it, right? They can call you, text you, have
Mhm.
conversations, kind of talk a little bit about like how are you using telehealth to build a better connection to your patients.
I think it's really that availability and flexibility and convenience that telehealth provides, especially since the COVID era, patients want to stay home, and they don't necessarily want to come into the doctor's office. And so having the flexibility to say, let's just do check ins from home, it just helps with adherence because you can kind of see them more frequently with telehealth. And I think patients feel more cared for because you are checking in on them, or they have the ability to kind of report their issues in a convenient way for them.
Yeah, and I think convenience and then, the cadence, having consistent outreach and communication because, oh, doctor, I had questions about this medication real quick, right? And so now the adherence is faster. We've seen that a lot of times. Having a nurse or someone kind of reach out proactively. Patients like, oh, yeah, by the way, yeah, this medication, I'm feeling some kind of way. A lot of people don't want to reveal stuff until you kind of go out your way to kind of
Mhm.
communicate it.
Yeah,
And so,
that's a good
so
point.
so to your point, having that kind of cadence and people feel that trust factor goes up, right? I was talking to doctors who practice all across the country. We talked about like, how do you build trust with patients? One of the
Yeah.
things they told me is like, having being transparent about who you are and what your values are. And that helps, get the patients to open up. What are some other things you do to kind of ensure trust via telehealth or just in your practice so patients feel, more comfortable to kind of
Yeah.
to open up a little bit more so you can help them.
I think that's a really good point. I think that a good number of my patients do have some distrust in the medical system. And that's kind of why they've sought me out because they've found me on social media and they've even been just following me for a while before they actually sign up for their membership because they kind of want to see what I stand for, want to see what I advocate for. And I think that's kind of the big thing is just to try to be an advocate for my patients. I think just being true to what I kind of preach on social media about really listening to patients, following through with it, actually sitting down with them. We don't go to the exam room right away. We come to my office, we sit down, we have a conversation, and I kind of ask them what they're looking for, what they're hoping for in a doctor, and kind of help guide their treatment plan in that way. Some patients want to be on medications, other patients want to try lifestyle first. And so I just try to see what their preferences are and help kind of guide their treatment plan that way. And I think that helps patients feel more comfortable just from the get go, just sitting down and chatting.
Hmm. Hmm. I love it. And that definitely, we always talk about the triple access, right? Lowering costs, improving quality, increasing access. Direct primary care is helping in all those kind of facets, right? Definitely, especially quality, because quality comes out to what they reveal to you so you can help them. And so I love that, coming to the exam room so you can have before you even go to the exam room, excuse me, let's have a general conversation in a relaxing office. I'm sure your office is nice. You probably have nice little pictures around. So it's a calming effect. So people
I
are
try.
open to those kind of conversations.
Yeah.
So I'm sure that's what's going on there. Let's talk a little bit about social media, right?
Mhm.
Pandemic obviously exploded, and a lot of doctors, which is necessary because there was a lot of misinformation going on during that time period. A lot of doctors became influencer and kind of communicated their expertise in this area. I talked to a nephrologist not too long ago. His post on how to breathe better and understanding if you have some COVID with some breathing exercises went viral. And so talk to me a little bit about the importance of getting out there. Number one, what made you get out there? Number two, how are you seeing the explosion in your business by putting yourself out there on social media?
Yeah, so definitely wasn't something I was trained in med school to do, right? That kind of business aspect of thing or the social aspect of finding new patients. But I think that's just the era that we're in right now. I think that patients really are on social media, and there are some very legitimate resources on social media. Of course, you have to kind of weed through them. But I kind of knew that that was going to be a really strong marketing resource for me. And I was trying to just be as organic as possible with it to show patients kind of what they're going to get when they do actually become a patient of mine. And like you said, you get a few posts that do go viral and you end up getting more followers, and in turn, the more patients can see you and get exposed to you, I think that they become more interested in your practice. So I think it's just a valuable marketing tool. I think, of course, social media has lots of negative aspects, especially for young people, but you can kind of pick and choose your poison with social media. And I think if you do follow more positive accounts, you can improve your knowledge, improve your health as well.
Know, like, trust, right? They have to know who you are, what you're about, that they like you, and then finally have to trust. And you can kind of do all that over time on social media because to your point, there's been literally not doctors, but maybe other consultants or other, business folks I watched over time before I was like, okay, this person is legitimate. I respect what they have to say. And we're pretty much, when we follow someone, we're saying, this is someone that I allow permission to influence me, right? Because
Right.
I trust what they say. And so to your point, even though you're in Southern California, the ability to kind of reach out, expand beyond that territory helps because you don't know, you can be helping someone in another state are moving, or maybe they know someone in Southern California and they're on the phone. I know Dr. Ansari's there. Why don't you go reach out to her? I love what she's talking about. And so you just don't know how all those interactions are happening behind the scenes, right? To impact your business, but also helping people no matter where they are. So I think that's important. Wow, this is great. I think you're doing some interesting things in the space, especially with your focus on direct primary care. I mean, I have stories of friends who went that route because they just couldn't get the help they needed, for special issues. They needed the time and space to kind of communicate their issues. Like one friend, she had a foot issue, couldn't solve it for a long time with her primary care through her insurance. She actually I think she went through Concierge though. And
Mhm.
that doctor helped her, like you said, not just with the medications, but understanding lifestyle changes, understanding functional medicine, things like that, so that she could get the space she needed to get healed up because she was just struggling for like years before she got her foot issue taken care of. So you definitely provide a valuable resource. Where can people find you? What's the next on what you're working on?
So there are some great resources out there. You can easily just search direct primary care near me. But to find me directly, I do have a practice website, harbordpc.com. And then my Instagram handle, I probably should have put down there, but it is Dr. Jihan MD.
Awesome. Awesome. Well, everyone, please listen to what she has to say. The value and trust that she's enduring on social media is very important. But more importantly, if you have patients that's in the area that could use her services, definitely go check it out. Dr. Ansari, thank you so much for your time and showing everyone, and especially physicians and other medical practice owners, there's another way. There's another pathway, right? This is what we have to experience in this new normal of healthcare. So thank you for your time. I appreciate
Oh,
it.
thanks for having me, Theo. I really appreciate it.